Hey there, my name is Harrison Vo. I'm a current resident at Georgia Eye Partners, and my case report is called One Flew Over the Encapsulated Bleb. Our patient is a 63-year-old white female who was referred to our specialty lens clinic for a scleral lens fit for both eyes due to filamentary keratitis and severe dry eye symptoms while in the setting of glaucoma. She's had two trabeculectomies in the right eye and one trabeculectomy and a tube shut in the left. And she also has underlying macular scarring in the right eye and cystoid macular degeneration in the left eye. We did corneoscleral profilometry on our patient. In the right eye, we can see the two locations where the trabeculectomy took place, as well as a superior temporal elevated 892 micrometer bleb. In the left eye, we can also see where her single trabeculectomy took place. This bleb is a lot shallower, about 313 micrometers, also superior temporal in location. We took baseline corneal topography scans of both eyes. As you can see, the surface of her cornea is a little bit irregular, but that's due to her underlying ocular surface disease. She does have filamentary keratitis as well as severe dry eye. And definitely this scleral lens fit should help with masking the irregularity of her cornea as well as relieving her dry eye symptoms. Before fitting her with a diagnostic contact lens, we measured a dry manifest refraction just to see what her visual potential was with glasses. She does have a macular scar in the right eye, as well as some cystoid macular edema in the left. We ended up choosing a Zen lens Z8 and Z9 as our initial diagnostic lens. And we also performed an over-refraction, and we pretty much got the same visual acuities, 2050 and 2040 minus 2, as we did with our dry manifest. With the two diagnostic lenses on her eye, she felt the saline relief right away. For the right lens, the bleb was located from 10 to 12 o'clock. It had a high depth and it was 4 millimeters into the lens. There was a little bit of leakage at 9 o'clock right below the bleb. In the left lens, the bleb was at 11 to 1 o'clock with a much more shallower depth and it was only 5 millimeters into the lens. So the changes that we're going to make to these diagnostic lenses for the right eye is that we're going to steepen the base curve by 3 diopters. We're going to incorporate the over-refraction. We're going to decrease the LCD by 100 and increase the SAG by 50. For the left lens, we're going to incorporate the over-refraction. And then once we decide what the rotation of the lens is, we will incorporate the microvault. So this is the contact lens that we ordered. Our second diagnostic lenses arrived. We do note the rotation of the dot being at 6:30 in the right and 5 o'clock in the left. We do have the same notes about the bleb as last visit just because we haven't incorporated the microvault just yet. We did oversteepen the right lens and there's about 0 clearance nasally. We also did a spherocylinder over refraction for the right eye just to see if we could improve the vision any more than we did in the past. So for what our next lens order, we're going to return the base curve back to an 8.4 and we're going to incorporate that over refraction into the right eye. We're also going to start the order for the microvault for both eyes. So for the right lens, the microvault axis is 135. The decentration is 8.5 millimeters. The diameter or the width is 8.5 millimeters and the depth will be 850 microns. For the left lens, the microvault axis is at 20. The decentration is 8.5 millimeters. The diameter is 8.5 millimeters and the depth is 300 microns. The third diagnostic lens arrives, incorporating the microvault into both eyes. The lenses are rotationally stable with the dots in the same location as we noted last visit. With the right lens, it does have moderate compression of the bleb, and in the left lens, it actually overall has a really good fit, especially around the edges. For the right lens, We are going to increase the SAG by 300 and change to an oblate design just because our central clearance was pretty shallow at 77 microns. For both lenses, we actually did overshoot the decentration of the microvault, so we are going to cut it back with our next lens order. The fourth diagnostic lens arrives, and there's still impingement of the blebs in both the right and the left lens. The right lens, after changing the design to an oblate and increasing the SAG, we have much better clearances overall. We also did an over-refraction for both lenses, and we actually got her to see a little bit better, 20/30 -2 for both eyes, and about 20/25 minus for both eyes together. And with our next lens order, we're going to incorporate the over-refraction and increase the depth of the microvault for both lenses. We decided to dispense this current diagnostic lens today. We were able to do insertion removal ×1 successfully in the traditional method. We also gave her some educational materials over what types of cleaners, conditioners, and filling solutions that we recommended. We also wanted to start her off with a 2-hour wear time and then slowly work her way up to a 4, then 6, then 8, and then a full day of wear. We also released this lens-based device for her since she does have a little bit of hand mobility issues just because she does have underlying rheumatoid arthritis. So definitely this device helps with insertion. We're also going to mail the new contact lens order to her house, and then we're also going to evaluate her in 3 weeks to see how she's doing with those new lenses and how she's been doing with taking care of her new lenses, insertion removal, as well as deciding whether or not we do need to make any more adjustments to these lenses. Some clinical pearls from this case is to remember that scleral lenses can treat dry eye and ocular surface disease and not just keratoconus. Patience is going to be a huge part of this process since it will take multiple visits and multiple lenses before achieving the right fit. It's also important to incorporate the microvault after you stabilize the lens. The lens has to pretty much be in a certain position so that that microvault can vault over whatever obstruction is in the way each time. Also, take your time with measuring the microvault parameters. I personally like to use a narrow slit lamp beam. There is a degree dial on the slit lamp itself, and that's what I use for the axis. And there's also a millimeter dial on the slit lamp, which I use for the decentration and the width. If you do have a anterior segment OCT, that'll be super helpful with determining the depth of the microvault as well. So my patient was super unique. She had rheumatoid arthritis and hand mobility issues. So I was really happy to find this lens-based device that really helps with INR for her case. I know that INR is probably the biggest hurdle for most new scleral lens patients to get through. And I'm sure there's plenty of resources and tools available for whatever your patient needs out there. And thank you so much for attending or watching this presentation, and I hope you'll have a beautiful day.